Mr. Nikhil, can you please, you are appearing for health or automobile?
The health.
Acha. Can you please tell us about yourself?
Yes, sir. My name is Dr. Nikhil. I come from district Pathankot of Punjab. I'm an enthusiastic and a determined man with a positive and healthy mindset. And so I completed my schooling from St. Joseph's Convent School, Pathankot, and I completed my graduation in the year 2020 in B.D.S, which is Bachelor's of Dental Surgery. So then after that, I worked in a private clinic for more than a year, which is close to 14 months, sir. And presently, I'm working as a medical officer with the Medicist insurance firm. And sir, I am a passionate cricket player and a pet lover. And other hobbies are fitness, singing, music, reading, and yes, sir. And I am someone who is actively involved in sports and co-curricular activities in right from the very school days and college. And I have represented teams at well, teams as well, and I have won uh, different medals for whichever team and institution I have represented or as an individual. Yes, sir.
You are basically a native of which place?
Sir, sir, from Punjab. I'm from Punjab, Pathankot district, Punjab.
Pathanpur district. Acha. I have not heard much about Pathanpur district. Can you tell me what is it
Yes, sir.
famous for? What are the crops grown? What are the industries there? Who are the famous personalities there? And what is the occupation of the main occupation of the people?
Okay, sir. So Pathankot district, it is the northernmost part of the Punjab state. So it is like a crown. We can call it the crown of the Punjab state. So the it has geostrategic importance as well because it is the part of Punjab which connects Jammu and Kashmir with Punjab.
Oh,
It is a, yes, sir.
great.
If it is blocked, so there would be no movement from Punjab, especially for the army men. So you must have heard about the 2016 attack that took place in Pathankot when the
Mhm.
terrorists attacked the Air Force station. It is
What's
that Pathankot, sir.
Acha, doesn't matter. Correct. Now, what is the crops grown in your area? What are the industries? Who
Sir,
is your MP?
sir, MP, sir, Lok Sabha MP from our constituency is Shri Sunny Deol,
So he
the
belongs
actor.
to which party?
Sir, he belongs to the Bharatiya Janata Party.
Acha, ठीक है. Is there any minister in the union cabinet from Punjab?
Sir, from Punjab.
नो
No, sir.
आइडिया. नो आइडिया. डजंट मैटर.
No,
बाद में देख
no, sir.
लीजिए. बाद में देख लीजिए. आपका डिस्ट्रिक्ट में कुछ इंडस्ट्रीज वगैरह होता है?
No, sir. So there aren't. It is basically you know, the people here practice business more often and agriculture.
एग्रीकल्चर. अच्छा
It is
अच्छा.
not an industrial area. The
अच्छा. Is
industrial
it?
area is in the
Yeah.
southeastern western parts of the Punjab. That is Ludhiana,
How
Patiala,
how many
Chandigarh,
non-resident
Mohali.
how many non-residents will be there from the district? Most of the people go away to foreign
Yes, sir.
countries. Acha.
Yes, sir. Sir, they go to various foreign countries such as Canada, Europe, Australia
Oh,
to study. Yes, sir,
to
and
study and
earn a
also
living.
to work. Very good, very good.
Yes, sir.
So, what is the extent of separatist movement in that place? It is there or not there? Like your Khalistan, no?
Yes, sir. Sir, as far as what I have observed, the people of Pathankot are peaceful people. They are very loving, kind, and
Excellent.
they are somebody who
So no,
welcomes
no,
and
nobody,
show.
nobody supports separatist movement. Correct?
So very few next to. No, next to nothing. What I
Acha,
see.
very good. Yeah. Did you go through the links I have been posting periodically in our WhatsApp group for dental questions?
Yes, sir. Sir, I went through a few of them as I'm working also. So yes, sir. I went through two to three of those. I
Explain
read those
what
articles.
what causes bleeding gum.
The bleeding gums, so it can be due to multiple factors, sir. First of all, if you are not having a good oral hygiene routine and you are not brushing your teeth, or any oral manifestation of a health disease, sir, or any food impaction in the gums, there various gum problems like periodontitis, gingivitis, and other other sir, bad oral practices like consuming tobacco, cigarette smoking can lead to bleeding gums.
Oh, acha, good. Mm,
Yes, sir.
what other than gingivitis can cause gum bleeding?
The gum bleeding, sir.
Other than
Yes,
gingivitis, what is gingivitis?
yes, sir. So,
gingivitis का मतलब क्या है?
sir, gingivitis means, sir, the inflammation of the gums. So when it becomes more severe, sir, it can lead to bleeding gums, which can be from moderate to severe if we do not maintain a proper oral hygiene. And in extreme conditions, we need to consult the dentist.
Mhm.
Sir, it is because of basically due to prolonged neglect of the oral hygiene, or any if any food particle gets and lodged inside the gums, it can lead to that as well, and it has not been brushed properly, or any
How
pathological condition taking place
how
in the.
how long have
Yes,
you
sir.
been practicing as a dentist?
Sir, after completing my graduation, which also involved 1 year of compulsory rotatory internship, sir, I worked for around more than a year, maybe close to 14 months. I worked in a private clinic.
Now you are
So,
working for whom?
sir, now I'm working as a medical officer with
Acha, acha,
Medisys
you told
Private
me you are
Limited.
working in some
Yes,
insurance
sir.
like
Insurance
firm where
firm.
you will be going to hospitals for audit, correct?
Yes, yes, sir. Medical audit, and yes, sir. And checking the
Medical.
patients.
I remember. I think we talked
Yes,
about
sir.
it 2 or 3 days back.
Yes, sir. Yes, sir. Day
Ex-
before yesterday, sir.
Excellent. Mention what are the symptoms of tooth infection.
The tooth infection. Okay, sir. So first of all, the patient will start experiencing pain. It can be from a simple pain to a throbbing pain. The first, second, sir, it will lead to inflammation of that area. So it will lead to redness of that area. So there will be a loss of, it can be a loss of function in that particular area as well. So then there will be, you will experience a rise in temperature also of that particular site.
Oh, yeah, here they are given some other ideas like say toothache, having
Yes,
pain
sir.
while chewing, hot or cold,
Yes, yes,
sensitivity
sir.
of
A
the
loss of
teeth,
function. Yes, sir.
bitter
You will
taste in the
experience.
mouth, possible fever, breath odor, swollen glands of the neck, general discomfort, upper lower jam area swollen.
Yes,
Very, very good.
yes, sir.
How many root canal treatments you would have handled by yourself?
Sir, I think because the time that I went to a clinic, so it was the pandemic time, so there weren't much of the patients that you could examine, because
Oh,
there were restrictions
because
also.
you know,
Yes, sir.
yeah, because the disease will spread. Yeah,
Yes, sir. Because we
yeah.
have to
Now,
deal with the mouth and
ex,
saliva,
ex,
so
explain
we
what
have
is
to.
root canal. Explain what is root canal. Tell the procedure of root canal.
Okay, sir. The root canal treatment, or RCT, sir, it is a procedure in which, sir, basically what happens is, when the infection proceeds towards the pulse, which is the deepest part. So the nerve supplies, they start they get triggered, and you see inflammation and pain, and that is unbearable pain which the patient experiences. So what root canal treatment does is, we need to cut that supply, nerve supply, so that the sensation of pain is stopped. So
Mm,
so so it involves the 5 to 6 basic steps. First of all, we need to have an open access cavity. So like, we need to have that visuality so that we can see the tooth. So after
right.
that, which we make with the help of a air rotor. Then,
Mm,
sir, we have to clean that site where the infection takes place. So then, sir, the second step, which is known as the working length determination, we measure the length and the depth of the till where the infection has spread. So then after that, we have to clear that area, and
mm,
then, with the help of what we call it as obturation, with the gutta percha stick, we need to seal those root canals so that no
mm,
infection spreads further,
mm,
and that site is filled. And after that, applying the first we apply a temporary temporary filling, and after that, when the tooth becomes sound enough, and we pull that temporary filling, we fill it with the permanent tooth material, and
what are
after
the
that we have
instruments used for root canal?
the instruments. There are various instruments. Depends. We have files. We have files of various sizes,
I
which is
think
which
you are
is
not up to date. You are not up to date. The
night eye
material
instruments. Yes, sir.
material says Lentuno spiral filler or rotary paste filler, finger spreader,
Yes, sir.
endodontic plugger, गट्टा पर्चा पॉइंट्स
This is better
obturating
purchase.
सीलर्स ये सब आप पढ़ लीजिए एक बार वो लोग पूछ
Okay,
रहे
sir.
हैं नहीं पूछ रहे हैं पता नहीं मोस्टली दे विल आस्क क्वेश्चंस रिगार्डिंग योर ओन वर्क ओनली
Okay, sir. Okay, sir.
your work is
I'll
doing
have. Yes, sir.
your work is doing auditing in various hospitals.
Yes, sir. Medical audit. Yes, sir.
Yeah,
And in
without mentioning the name of hospital, can you tell us what are the major mistakes you found, major faults that were committed in some hospitals? Don't tell us the name of hospitals or the place where it is situated. This question is asked to find out whether
yes, sir.
you follow what you are doing.
Okay, sir. So as far as the hospitals that I've visited, I didn't find any major blunders done by them. It was all good, but what I find is, sometimes they they show this they have this habit of not updating the data at the right time. They show this procrastination behavior, what shouldn't happen. I mean, on the cause, and sometimes they show delay in admitting the patient. This is what I've come to.
So you have not seen any major mistakes.
No, sir, no, sir. They have been
No.
doing quite well in my district.
What type of mistakes can be committed by hospitals? Suppose you have not found any major, but हो
Yes, sir.
सकता तो कोई हॉस्पिटल में कुछ गलती काम कर रहे हैं तब
Yes, sir.
क्या क्या गलती काम कर सकते हैं?
So what they could do is, they could, bluff the patient that, for these reports, you need to pay extra charges. They can take money from the patient, and which is not, which shouldn't happen, because it is a cashless and paperless insurance, which the beneficiaries have.
Hmm.
Yes, sir.
Yes, please. Acha, very good, very good. Mhm. Explain what is trigeminal neuralgia. Neuralgia.
Neuralgia, trigeminal neuralgia. So trigeminal neuralgia is related to the fifth cranial nerve, which is the trigeminal nerve. It has the three branches: maxillary, mandibular, and the I'm forgetting the name of that. So in this, so even if it is a neurological condition in which even if you are triggered, you can your face can be triggered by you know a cold breath, or even if you make a movement and there's throbbing pain from your uh, face and that nerve. So it is a very very serious kind of a situation where you face uh, right
It,
very
it is
throbbing
it is
kind of pain.
it is given
Triggered, you are triggered by.
it is
Yes,
given
sir.
trigeminal nerve is one of the main nerves which
Yes,
originates from the brain stem
yes, sir.
and enter the face and end in the tooth bottom.
Yes, sir. So you are triggered by responses
When
like
this when
cold
this
breath.
nerve
Yes,
gets disturbed, damaged during an accident or while operation, it causes the pain as trigeminal neuralgia. Such condition is most commonly found among elderly people and those having hypertension.
yes, sir.
Acha,
So even some of
can hypertension also can cause tooth pain?
not really, but it can in some cases, but mostly not. No, sir. Mostly it is due to an infection or
Mm.
any underlying disease.
Explain what is the role of fluoride in tooth.
So fluoride plays a vital role in the development or which is related to the the, the fluoride. It has anti-carcinogenic properties and it remineralizes your tooth. So that is why it is present in toothpaste
Excellent.
up to a certain yes, sir, limit.
Demineralization and also remineralization. You told
Yes,
correctly.
sir.
Very good. Very good. Explain what do you mean by air abrasion, AIR, abrasion, ABRASION.
Yes, sir. Sir, the, the abrasion means the outermost part of the tooth due to some suppose we are eating where over time, sir, it gets the small parts of it or the tooth starts degrading,
Oh,
like the outermost part of it starts shedding due to many. It can be due to the change in pH of the mouth, the acidic nature of the foods that we eat.
hmm.
Yes, sir. So yes, sir, or any hard thing that we eat, it could chip off those. That could be a part of the tooth, but small parts can also be chipped off. That is
How
known as
safe
abrasion.
are dental x-rays?
Dental X-ray.
How safe are they?
So exposure to any X-ray over a prolonged period of time, I would recommend it to be harmful. But we take care of those X-rays. I mean, as dentists, we need to provide those cares to the patient as well if he is going for a prolonged period of time, many X-rays. So, but considering the IOPA, which is the intraoral, which is the dental X-rays, so it is uh, it is
Yeah.
safe.
आपने
It is
ऐसा
safe.
बोलना है
Yes, sir.
exposure to excess amount of x-rays may cause
Okay,
cancer. However, controlled x-ray exposure or safe to use with
okay, sir.
advanced digital x-ray machines which limits radiation beam to a smaller area and for shorter period it makes it even safer.
Okay, sir.
What is ALVEOLAR? Alveolar.
Sir, could you repeat, sir? Alveoli.
ALVEOLAR. Ah, correct. What is that?
Sir, yes, sir. The alveoli are present in our lungs,
Huh?
or they're also known as alveoli sacs.
Huh?
So,
What is it?
yes. So these are alveoli are present in our lungs. It is a part of our lung system. So they help in breathing.
Doctor,
They help us in.
doctor, totally wrong. Doctor, totally
Yes,
wrong.
sir.
Alveolar is used to refer a bone that is
No,
attached
sir.
to the
Sir,
tooth.
no, sir. I was telling about alveoli sac. So alveolar is alveolar bone. Sir,
Alveolar bone. Yeah, yeah.
yes,
You
sir.
should
I
have
thought you
told
were saying
simply
alveoli
bone.
sac.
You should have simply told bone. What is the other alveolar?
The alveolar which we are talking about is alveolar bone. So it is part of our mandible, which
Yeah,
is
yeah.
the
No,
bone
no.
of
This
our.
is the answer I expected. You must have simply told me it's a bone attached to the
No, sir.
tooth. But आपने
Yes,
और
sir.
कुछ बोलते थे वो क्या चीज है?
Sir, alveoli, you could even search the alveoli sac. It is present in our lungs, sir. I
अरे
thought you
भाई,
were asking that.
why for a dentist they are going to ask about lungs unless they refer to lungs and all that. समझ गया?
Yes, sir. I misinterpreted it. Alveolar
Yeah,
bone is a part of
yeah.
the
You have
mandible. Yes, sir.
misunderstood. You have misunderstood.
Yes, sir. Yes.
What is the difference between endodontics and orthodontics?
So endodontics is a branch of dentistry which is basically related to the prevention of the tooth cavities, so the root canal treatment, and it is basically the preventive dentistry for the caries and stuff. So there is orthodontic treatment is related to the prevention, interception, and correction of the malalignment of the tooth, which involves the dentofacial region as well. So
Super.
which
Super.
basic.
This
Yes,
question you answer very nicely. Correct. Thank you. Can you
thank you.
explain what is the role of dental hygienist?
The dental hygienist. The
Mm,
dental hygienist, sir, as far as what I am remembering, these are dental auxiliaries, sir, in dentistry, sir,
mm.
and dental hygienist, sir, their main function is to assist a dentist in a dental clinic or any setup. So, and within the presence of or supervision of a dentist, they can perform, sir, like the scaling, root planing in the supervision of the dentist. They can assess, but what they basically do is assess the dentist.
Explain what is a site specific laser therapy and when it is required.
Uh, I'm not aware of this.
I suggest you go through all these materials I have just now given in our group. पहले भी दिया था और कुछ ये वाला नया चीज लगता है, इसको भी थोड़ा
Okay.
पढ़ लीजिए. Okay, because
Okay.
every day things are changing. Like in banking, what I did in banking is entirely different from what is banking today. I Samapi आपको, when did you come out of practice?
It was in the year 2021, sir.
2021.
Yes, sir, early 2021.
Then not bad, only 3 years. थोड़ा इसको ये सबको पढ़ लीजिए. Then very good. You have been answering patiently all the questions I was asking. Even though I don't know the answer, I was asking question based on what is given in the internet. I am very thankful to you for answering
Thank you,
it.
sir.
Last
I'm
question for
extremely
you. What is galvanic shock?
the galvanic shock. So, this shock is experienced when the maxillary and the mandibular tooth,
Mm.
so when they come in contact, close contact, and suppose one of the tooth is filled with any filling, suppose like amalgam or any other. So there's this sensation that is experienced. So
Sorry.
it can, which is in the form
Sorry,
of a.
it's a wrong answer. Galvanic shock is referred to an electrical shock that you might experience in your mouth if you
Yes, sir.
had amalgam filling
Yes,
adjacent
sir.
to
That
gold filling.
Yes, sir. That is what I'm saying. That different materials. Yes, sir.
The electric current generates due to interaction of two different metals. So it is better not to have gold and amalgam filling adjacent to each other. Probably
Each
you
other.
were
Yes, sir.
referring to this only. Anyhow,
Yes, sir.
thank you. You told correctly.
Yes, sir.
And
Thank you so much, sir.
yeah,
Yes, sir.
best wishes. Now the general HR questions will be tell about the role model you have. Why do you want to jump from the say your present role to NIACL? Why were you not doing regular practice? Do you have people related to you working in dentistry? Why did you choose dentistry? And
Yes,
what
sir.
are who are the important people in your area? And are you willing to be relocated in other parts of India? How will you manage if we post you to Kerala? This type of questions they will ask, and I
Okay,
think
sir.
you can manage very well. No problem. Do you
Thank you.
have
Thank you,
any
sir.
other doubts you have in your mind? थोड़ा आवाज में थोड़ा कॉन्फिडेंस कम लगता है.
Okay, sir. Sir,
I
I'll
don't know.
make sure that I'm.
Maybe
Yes, sir.
what is your age?
Sir, I am 29.
Thoda, you must appear like a 23-year-old boy. 24
Okay,
year old boy come abhi enthusiasm you must bring.
okay, sir. I'll definitely bring that.
Be smiling always, enjoy, don't forget about, even if you answer wrong, give a wrong answer, don't worry, smile. If
Okay,
you
sir.
do not know the answer, say I don't know.
Okay, sir.
So this is how you will manage. I'm sure you will succeed, and I wish you best of luck. And also follow what are the questions that are being posted in our group. Not many
Yes, sir.
candidates are posting. Yesterday or day before yesterday, some candidates are posted. Did you go
Yes,
through
sir.
those questions? Yeah,
Yes, sir. Yes, sir. I did. I did, sir.
yeah, very good. Please go through like that and improve yourself. I am sure you will succeed. But सब
Thank you,
भगवान
sir.
का हाथ में है. सब भगवान का
With your
हाथ में.
guidance, sir.
या
Yes,
हम
sir.
लोग का हाथ में
And
कुछ नहीं
blessings.
जी. Yeah. Blessings are there. Blessings are
Yes, sir.
there enough for you. And in fact कोई लड़का ना लड़की ने ऐसा ही बोला था. अरे
हाँ
सर
जी.
आपने तो बोलते थे ऐसा भी होगा और हमारा ऐसा
हाँ
ही हो गया.
हाँ जी.
आपने उसको देखा.
हाँ जी, सर. मैंने पढ़ा था वो मैसेजेस मैंने पढ़े थे.
Hmm.
And
But
she was
this is
saying
this is
कि
this is only 50. I was telling 60-40. अभी हम बोलेगा luck is
हाँ जी, सर.
65, merit is 35.
Yes, sir.
Because वो the reason is simple. वो लोग को बोर लगता है. इतना
हाँ
आदमी
जी,
से
सर.
वो बात करेगा वो इसलिए वो बार बार रिपीट करने का बोर लगता है. एंड उस
Yes,
समय
sir.
पर आप हैप्पीनेस से जाके आंसर करना है. गुड.
Yes, sir.
I wish you the best of luck, Dr. Nikhil. Another question they can ask you is that why are you not going for post graduation? Possible answer is मेरा घर में पैसा नहीं है और घर को
Yes,
फैमिली को सपोर्ट देना पड़ता है
yes,
इसलिए
sir.
हम नहीं गया. शादी तो नहीं हुआ ना.
Yes, sir.
शादी हो गया नहीं हुआ.
सर, क्या किसके बारे में सर ये क्वेश्चन?
आई एम आस्किंग फॉर यू. आर मैरिड और नॉट?
No, sir. I am not yet married, sir.
गुड. Excellent. At what age would you like to get married?
Sir, it depends on, sir, life is unpredictable, sir. When I find the girl of my life, or the love of my life, after settling down, I'll definitely will get married soon.
This is a good answer. After settling down is a good answer. You don't
Yes.
have to say life is unpredictable and all. ऐसा
Okay, sir. I'll
ऐसा
I'll look at it, sir.
spiritual मत बोलिए. इधर जरूरत नहीं.
Yes, sir.
Who is the
Okay,
leader
sir.
who is the Guruji of your family?
Sir, it is my father.
No. I'm asking you belong to Hinduism or Sikhism?
Sir, Hinduism.
Hinduism.
Yes, sir. I
तब तो
follow
आप लोग
Hinduism.
शिव जी को फॉलो करते हैं ना.
Yes, sir.
शिव जी और
Yes, sir. ev-
Narayan ji.
ev- yes, sir. So basically, my mother, she is a Shiv Bhakt, and my father as well. Sir, personally speaking, sir, I am someone who believes in the fact that I am a bit of an agnostic person. So I don't pray much, but I just thank
Okay.
this universe and nature for whatever has been provided to
But
me.
if in case by chance you get a question in the interview, you tell the
Okay,
name
sir.
of some god, Shivji or Narayanji, something like that. It's
Okay, sir.
better than you are trying to substantiate your not believing it. समझ गया?
Okay, yes, sir. Yes, sir. I get it.
That's all. Thank you so much. You did well.
Thank you, sir.
I,
It was a pleasure interacting with you,
I
sir,
will
and
give you
getting
I
those
will give
guidance.
you 9 out of 10 and select you.
Thank you,
But
sir.
मेरा हाथ में कुछ नहीं जी.
Yes, sir. Yes, sir.
No, the reason why I will select you, one, you are already working,
Yes,
you
sir.
are not idle. Two,
Yes, sir.
you have been able to answer the questions very well in English. इतना अंग्रेजी में बोलने का जरूरत नहीं, आप हिंदी में भी बोल सकते हैं. वो लोग को हिंदी में बहुत प्यार है,
ठीक ठीक है, सर. मैं इसका भी ध्यान रखूंगा.
इसलिए उन लोग से आप हिंदी में बात कर लीजिए. वो लोग आपको 1 मार्क
ओके,
ज्यादा दे देगा. ठीक है?
ठीक है सर, मैं इसका भी मैं ध्यान रखूंगा.
वेरी गुड.
And
थैंक यू.
your valuable guidance and tips will be very fruitful for me, I guess.
Very good. Best wishes. God bless you. I wish you success. Please
Thank
post
you,
the
sir.
questions they are asking you in our group.
Definitely, sir. Definitely, sir. It
Thank you.
was a
Bye
pleasure
bye.
talking to you, sir. Thank you,
Thank
sir.
you. Thank you. Bye. At what time is your office?
Sir, I reached by at 10 a.m. 10
अच्छा
a.m.
ठीक
or
है.
10:15.
अभी तो समय
Yes,
है.
sir.
Thank
Reporting.
you. Bye bye.
Thank you, sir. Okay, sir.